How do you get into the Medicaid LTSS program, or what's more commonly known as the long-term healthcare program? All right. So listen, if you on here right now and you're trying to get into the program, you're trying to figure it out, you're trying to figure out how can I get a paid caregiver? Stick around to the end, man. I promise you, I'm gonna let you know everything. All right. So look, if you don't know who I am, my name is Kion Church. A lot of people call me Mr. KC. They say it sounds a lot easier. I'm your in-home healthcare guide. But listen, on a big major level, what do? I help financially challenged family members to become paid caregivers through the Medicaid Long-Term Healthcare Program, so nobody has to go broke trying to take care of somebody else. Now, it could be just me, you know what I'm saying? This could be my own personal SHI, you know what? But I really feel like if I dedicate my whole life to trying to help somebody, it's kind of like somebody making me suffer if I don't got no paycheck. That's crazy. You know what I'm saying? Now, don't get on my English because I know ain't got is not supposed to be one word right after another. You know what I mean? My grandma taught me better when I was a kid. But listen, I'm trying to get to the bag for you right now. So sometimes I might have to give you the real raw uncut. You know what I mean? Now, if you with me and you like this good uncut information, hashtag live, hashtag rebroadcast, hashtag your city, hashtag your state. If you got a cousin that's in Medicaid, if you got a cousin that needs a caregiver, if you got somebody that you taking care of, put their name in the comment, man. See, a lot of people see it, but they don't actually tune in on it, and they be thinking like, KC crazy. You know what I mean? What are he talking that crazy talk? Ain't nobody paying. But guess what? A lot of people getting paid, man. A lot of people getting paid. You need to put some extra money in your pocket. You got to be in the program. Now, how do we get in the program is the question. All right. Because, KC be long-winded. I don't want to lose you, right? So listen, number one thing you have to do to get a paid caregiver is be in the program, right? Now, what do you got to do? You got to be in Medicaid. All right, you got to be in Medicaid. See, now I'm saying this because this is like a prerequisite, which means something that you must do first. Somebody said they texted me. But, if you're trying to get in touch with me while we on the air, 302-689-3240, 302-689-3240. Feel free to drop your question on me while we on the air. Now's your time. You know what I mean? Also, like this post, heart, you know what I mean? Share it. Do what you got to do. Subscribe. If you find this information valuable, definitely subscribe. If you find this information to be like some BS, you know what I mean? Don't even subscribe. It's not even worth it for you. You feel me? So now I'm gonna just let you know. Everybody call me. I got Aetna. I got this. I got that. Listen, none of that works. You must be in Medicaid. Medicaid is the only insurance company that will pay a non-skilled person. So I'm talking to a lady yesterday. She just didn't get it. Yeah, well, my cousin's a nurse practitioner. Can I get her signed up? Yeah, you can get anybody in the world you want signed up. You know what I'm saying? Anybody. But got to be in the program, and that's just what it is. So look, about the nurse practitioner thing. The reason why I said that is because people think that if you got more qualifications, you're going to get more money. Nah, that's not how it works. We'll go into that a little later, but right now I'm going to tell you how to get in the program. All right, so we got the prerequisite out the way. You got to be in Medicaid. Now, what do you do to get into this program? For real, I'm going to tell you, all jokes aside, you got to put in an application. Now, you know how the world is, man. They make you apply for everything. If you want it, hey, man, they got it. You got to ask to get in. So what do? You say, you call them up. This is what I do. I'm going to give you a pro tip. Now, this is just to start out with. It ain't got nothing to do with, how you get in or whatever. But this is what you do. I always call them up on the phone. I'm like, look here, man. I'm here with church right now. He need to fill out an application. Now, I'm going to tell you what they're going to say. They're going to say, look, man, we don't fill no applications out over the phone. I'm going to say, look, we can't get in. We can't get in. I don't know, whatever. They're going to say, all right, well, it's too bad. I'm going to say, nah. This is how we doing this. Put down that we starting the application now. We need our name on the roll book, on the record call. You know what I'm saying? I want somebody to know that even though they don't got my application physically in their hand, hey, church got an application coming through. You know what I mean? Y'all need to get this thing started. All right? So after that, they're going to tell you, come on in, fill it out, do whatever. They'll mail it to you, whatever. Send it to me. That's cool. But just know that, y'all be expecting some stuff from me right now. All right. Can't talk right now, man. Look here, Mr. Bobby. I know you calling me. You want to rap. If you want to talk to me, 302-689-3240, 302-689-3240. That's how you get in touch with me when I'm live on the wire. All right. So get the application turned in. You're going to fill it out physically. You know what I mean? Help the people who you with, or if you the person, you know, you get somebody to help you out, fill that application in. Now, it's 3 parts or 3 things that's going to happen once you turn this application in. The magic just going to start rolling, man. Trust me. All right. Now, the first thing that's going to happen is they're going to assign you a nurse. Now, what the nurse is going to do, the nurse is going to make contact with your primary care physician, your PCP. Now, the nurse is going to ask your primary care physician for a, I forget what the word is called, but basically it's just a summary of you and your medical history. It's called, okay, this is the word, comprehensive medical report. Listen, man, these $5 words, man, they be busting me sometimes, man. I can't remember everything. But listen, as I remember them, I'm going to drop it on you. So the nurse is going to contact your doctor for a piece of paperwork. You know, we just told you about it. All right. So once they get the report, you know, they're going to have that all down. And what they're going to say is, okay, they're going to ask the doctor, they're going to say, look, does church need or belong in this program? Now, the doctor's going to say what he feel. You know what I mean? Now, I don't know. But me, I just want to remove all doubt. I want to know that when I set something up, it's going to fall down the way I need it to fall down. You know what I'm saying? A lot of people say, oh, KC, you always want to control the situation. You absolutely god darn right. I want to control the situation because my peoples need a paid caregiver. You feel what I'm saying? So what I'm going to do, I'm going to call the doctor. You know what I'm saying? Now, what I advise you to do before you get into this program, make sure you go see the doctor, you know, at least once a year. Go see the doctor before you ask for the doctor's help. Pro tip, if you're not listening, listen. Before you ask anybody for a favor, make sure you're in their good graces. All right. Now, what do I mean by being the doctor's good graces? Go see the doctor once a year, at least once a year. Nobody don't want to do nothing for you if they're not getting paid, especially the doctor. The doctor only went to school for 30 years to make some money. You feel me? Now, if you're going to see him and your co-pays is paid and he knows who you are, everything is beautiful because now you're going to tell him something like this. Hey, I just filled out this application for Medicaid to get into this long-term healthcare program. What I need you to do is when they contact you, you tell them, get church in there. Boom. Just like that. Now you sweet because you got the doctor on your side. You feel me? They're going to reach out to the doctor for the comprehensive medical report. The doctor's already on point. So when they call him, they're going to say, hey, man, church a good dude, but he really need this program, man. I really feel like he'll benefit y'all and, you know, and he'd be great for the program. That's all it is, man. They're going to sell you right on through. Now, step number 2, deuce. All right. I don't know too many languages. So, you know what I mean? We're going to go straight on in on it. All right. Now, the next part is what's called financial eligibility. Now, what they're going to do is they're going to hook you up with a financial worker. Now, mind you, all this is going on behind the scenes. You don't even know how it's playing out. But they hooked you up with the nurse. Now, part 2, they're going to hook you up with this financial worker. Now, pro tip. KCB dropping a lot of pro tips on y'all. Make sure you got your pens and pencils out because I'm going to give you a good one. Now, financial eligibility. I'm going to tell you 2 things. Now, the first thing is you qualified. Now, how do I know you qualified? Because you're in Medicaid. You qualified, man. Don't be afraid. You already qualified. This step don't really mean nothing to you. Now, the only other thing that could bother you, which is the 2-part, is if you hit the lottery or maybe you got a dowry, you got married, they gave you a dowry. I don't know. You know, rich people make sure that the young couple is you know, financially good. As long as that didn't happen to you, you know what I'm saying? You ain't hit the Powerball, you didn't hit the Mega Millions, you didn't break that trust fund open, you know what I'm saying? And you know, in the interim, you good. You good, Playboy. Trust me, you good. You have met your financial responsibility. You good. Now, pro tip that I was telling you about, just to make things go faster, you got a bank account, download your statements. See, all they're going to do is they want to find out, you know, did you hit the Powerball, man? Like, what's going on? Has your income changed? Look, ain't nothing changed, man. What's changed is my condition, and I need more help around here. So look, here go my bank statements. You know what I'm saying? We're gonna push that off to the financial worker. Come on, let's get on to step number 3. Bam. Listen, if you ain't heard nothing else, this is your step. This is your step. This is your moment to shine. Now you getting your 5 minutes to tell these people what's really good. All right. So this part of this step is my favorite part. It's my favorite part. I got some other steps that's kind of favorite. 1 and 2, I like them a lot. But number 3, I'm gonna tell you how I feel about it. You know what I'm saying? Y'all know I got a big mouth because I'm on here every day talking. So I'm gonna tell you everything. Now, KC got a pro tip for you. Got a pro tip. This is what you need to do. Get your notebook out before they come to your house to interview you. Get your notebook out and write down everything. Write down everything. Now, listen, if you're here with me in the live, hashtag live, I can see you in the live. I just don't know who you are. So look, hashtag live, hashtag rebroadcast, hashtag, how your family treating you during these times and you helping people out. Hashtag, it's hard getting a check over here, KC. Hashtag, yo, whatever you want. Let me know. So, all right. We got this good thing called the interview. What I told you to do is break that pad and pen out. Now, why did I say break that pad and pen out? Because I want you to write down everything. Now, lady told me the other day, my case manager came into the house. She wasn't even here for 25 minutes, assessed the situation, and didn't give me no hours. Yeah, you know why? Because you ain't had nothing to say. You sat there while she was looking at you, and you was like, hey, man, everything cool around here. I'm Cocoa Beach. But you're not Cocoa Beach. You're not Cocoa Beach. You need some help. Stop playing, man. Stop playing. What I want you to do, get that pad and that pen out, write down everything. From the very moment the sun come up, you need help getting to the bathroom. I need help getting my walker out. I need help getting my wheelchair out. I need help transferring from the bed to the wheelchair. I need help getting to the bathroom. When I get into the bathroom, I need somebody to put that toothpaste on my brush. When I get to the bathroom, you might need somebody to help you get on and off the toilet. You might need somebody to help you get in and out of the shower. Put your clothes on. Put your socks on. Put your lotion on. It's a lot of different things. Brush your teeth, comb your hair. I don't know. You know what I mean? I don't know how deep it is with you. What I'm trying to tell you is write it down. Because if you don't write it down, when the people get there, they're going to say, oh, man, you all right? You sweet, we out. And they ain't going to give you no hours. You feel me? Then you're going to be all on my video. How do I get more hours at the case manager? But you didn't listen up front. You got to put the work in up front. I'm giving you the 3 best steps to get you this paid caregiver, man. All you got to do is listen. Write everything down. They're going to come see you. When they come see you, I want you spill it all out on them. I just want you puke it all out on them. Like everything you need. Tell them, man, flood them. And guess what they're going to do? They got to take care of you. You don't even know how many case managers I talk to that don't even care. That's like, oh, man, I went to see him. He ain't had nothing to say. Now, listen, I already know the case manager got a bad attitude. Your case manager sucks. You already know this. You know what I'm saying? So why even play the game with them? When they come out there, have everything, have the deck stacked in your favor, and then boom, you know what I mean? Get the results that you want. You know what I mean? You looking for some paid help, man. This is how you get it. You have to follow these 3 little steps, man. Really simple, really easy. You know what I mean? Anybody out there need any help with this, make sure you call me, 302-689-3240. If you're looking for a good agency or an advocate to get you all the way through from first base to where you sliding in the home plate, call me, 302-689-3240. Listen, it's been fun with you right now, man. It's really been fun with you. I love helping you, man. Anything you need, holler at me. All right? Now, look. The broadcast ain't over. I need to talk to the agency owners. If you're a home health care agency owner, PASA owner, whatever it is, you do healthcare, you help people, you my kind of person, I need to holler at you for a second. You know what I mean? Now, look, the other people left the room, so it's just me and you. All right. Just to start it off, man, I'm going to start giving out all the pro tips I can to people just like you. Everybody, every day, somebody calls me and like, yo, KC, what I got to do this? What I got to do that? How do we get paid for this? How much should I charge for this? Listen, I got answers to all your questions. At least everything that I know. And I got a lot of friends in this industry. You know what I'm saying? So all the information that I get, what we're going to do is we're going to bundle it up. We're going to start putting it on the web for you, making you owners, you agency owners, able to get the easy access to all the information that you need to be able to effectively run your business. You know what I'm saying? Listen. We striving to be 7-figure business owners. You know what I mean? We want our agencies to do good. Now, the only way you can be a 7-figure owner is if you helping a lot of people. Now, if your help strategy ain't all that, you're not going to make no dough. You're going to make minimal dough. I don't really know. You know what I'm saying? But you're not going to do good unless you help a lot of people. Now, how do you help a lot of people? You got to do it, man. You got to come up with the information. You got to know how to go. You know what I mean? You got to study these videos and let your people know. Listen, KC already laid out the 3 steps, you know what I'm saying, to getting into this program. This is what you got to do. You got to tell them that kind of stuff. You know what I mean? But you as an agency owner, you go through a lot of other stuff. I know you do because I do. You know what I mean? Now, at a 30,000 foot view, you may need help getting started. You know, you might need help. You might say, look, KC, I just went to the meeting and they gave me the rules and regulations. And now I need my policies and procedures created. Can you help me with that? Absolutely. I would love to help you with that. You know what I'm saying? You might say, hey, KC, I just figured out I can get United Healthcare to pay me, you know, for my clients. Can you help me get credentialed? Absolutely, man. Listen, I can help you with anything as far as bringing that money in, man, because that's what we love to do. We love to help the people bring the money in if you're an agency owner. You know what I mean? All right, you might say, hey, man, this electronic visit verification thing is kicking my butt, man, and my peoples ain't not clocking in on time. What should I do? Hey, look, we got some good programs that we use. You know, the caregivers, if a caregiver is late for a shift, it send me a text right on the phone. Send me a text. Boom. Mr. So-and-so is 5 minutes late. You know, now, probably when I call Mr. So-and-so, he going to say, look, man, my phone's acting stupid. It died, boom, bam. You know what I mean? But all right, that's cool. Now we got to change it and make it right and get you a new clock in time, clock out time. You need help with that? You need somebody in the backside? Let me know. We can help you with all that. All you need to do is join the 7-figure home health agency owners group, man, and we're gonna tighten you up, man. You as an owner, listen, it's hard paying these people sometimes. We got a 6-figure payroll, you know what I mean, every 2 weeks. Now, when Medicaid don't pay, these people still want to get paid. How do you pull it off? Let me know, man. You might need some business funding. You may need some business credit. And it's good to also have some credit because you don't want everything to rely on your personal signature. You know what I mean? If you got to be the personal guarantor for a lot of this stuff, it ain't gonna work. You know what I mean? Just because the nature of the beast and this monster that we growing, you know what I mean? You listen, you can't stop this monster because it's growing out of control. So you got to make sure the money's coming in. You got to have your audits right. You got to have your billing tight. It's a lot of things you need. You need help with that management, man. That 30,000 foot view. Call me 302-689-3240. Okay. Also, guy asked me the other day. He said, "Yo, KC, I already broke 50 caregivers a long time ago." He said, "But we ain't got no insurance." Listen, Playboy. I ain't gonna tell the government because that ain't what I do. I don't do that. But what I will do is I'm gonna tell you, I got some healthcare that you can put everybody on. Now, being so it's not major medical, it's really tied to the individuality of the person. It's like almost dirt cheap. It's gonna save you some money. It's gonna save the people a lot of headache. It's gonna get your people to the doctor, and you might be able to make a little money on it. I don't know, but what I'm telling you is your healthcare solutions is problem. It could be a problem for your workers. Don't let it be a problem. We have healthcare. All right, trust me. I'm gonna work it out for you. Good plans. No networks. See any doctor you want. I mean, yo, listen. Trust me. Your employee's gonna love you after this. Trust me. All right. So look, you need to make any extra income. And you're charging credit cards, I got something for you, man. I got a plan where you can make you can basically double dip on your credit. You know what I mean? You getting people and they paying private pay with them credit cards. I got a way you can get paid off them fees, man. So you got a company, and your company, you know, all they doing is servicing your clients. They're not really helping you. See, they figure like they're helping you because they provide you a convenience where, you know, your customers don't have to come out their pocket. But everybody got a credit card processing system. Why would you want to work with somebody who's not making you no money? Why would you want to work with anybody who's not breaking bread with you? Don't sound like we partners. Sound like you getting over on me. Feel me? Listen, don't let them get over on you no more. I got the 7-figure home health agency tips and tricks, man. Make sure you get into the group. You figure out what it's all about. Trust me, this is definitely for you. Now, look, I'm gonna have Miss Ludia drop it in the comments for me. Definitely sign up. You want to figure out how to make this money? We're gonna go live later on today. I promise you. All right. So look, don't let anybody shame or blame you into thinking that, you know, taking care of other people's bad business. We only doing this to get our blessings. You know what I mean? I love people and I love helping people. I love the regular people and I love the business owners. Love them. You know, I love them to death. So if you got love for me, like KC got love for you, man, make sure you sharing this. Make sure if you found some value in this, you liked it, you hearted this thing, you know, you left a comment on there, where you at, man. If you're watching this on YouTube, I love you. You know what I mean? Make sure you tell me where you want me to go with this. What part of your agency do you need help with? Let me know. All right. Look, I gotta go, man. Nice day outside. Hope you can enjoy yourself. I'm definitely gonna enjoy mine. All right. Love y'all. Peace.